everyone, it's Dr. Russell. So this month in March is Women's History Month, and women have done a lot of great accomplishments over the years, whether it's in science and medicine and art and all kinds of things. But we can't talk about history without thinking about the implications of history and where we still have to go. So that's why I wanted to focus a little bit different for today, talking about bias in medicine. So this is something that I'm very passionate about. I get discussions in this with almost all of my patients, it feels like, just because it's such a big issue that we don't even, I think, fully realize how much of a problem it is. So when I'm talking about bias in medicine, there is gender bias, there is ethnicity bias, religious bias, there's lots of different biases that can take place. But as a women's health practitioner, I wanted to focus mostly on bias against women in medicine. So as we know, women outlive men in this country. However, that number is not growing as much as it has been compared to other countries that are similar to us. So women in other countries, other developed countries, are living longer and longer, and we're not. With that, women's quality of life is decreasing because the number of chronic illnesses that women are being diagnosed with has gone up dramatically, and specifically in the last 30 years. But again, we're not living longer and we're not having a better quality of life. So that's really concerning. So I wanted to investigate, why is this happening? What's going on with that? So how does this bias show up in medicine? So the one thing that I hear again and again, and this is what the research supports, is that when women come presenting serious symptoms, those symptoms are being ignored. They're being dismissed, related to, oh, you're just stressed, here, take an antidepressant, or, oh, this is in your head, you're just making it up, don't worry about it. And I've heard time and time again, honestly, I joke that I should write a book about this, of how many women have had serious issues that their doctors have dismissed and ignored that actually were very life-threatening. So it's a common bias that we're just kind of not believing women for some reason when it comes to serious health conditions. A more specific example is with heart disease. So last month in February was Heart Health Month, and we talked a little bit about that. But women are more likely to die from heart disease than men, and that has been going on for a number of decades now, I believe since 1984. However, doctors are not as likely to even know that fact. So if doctors aren't aware of the fact that women are more likely to die from heart disease, how are they going to take it seriously when trying to prevent it? So it's a big issue, and just, heart disease is the #1 killer in America, second to cancers after that. So if this is affecting mostly women, that's really concerning, especially when for women and heart disease and heart issues don't present the typical textbook way as it does for men. So there's a huge knowledge gap with that. Another example, and something that's been getting more and more news lately, which is good, is racism in medicine. So we now know that Black women are 3 to 4 times, I've even seen some studies that say six times more likely to die from childbirth complications. This again is America. We have, pretty developed medical system. The fact that Black women are dying more frequently just from childbirth is ridiculous. So that's another type of bias that we can see with racism that occurs, so not only we have the women part where we're getting biased, but then the racism part, which is concerning. So this shows up, that's just a few examples, but many, many different ways that we see this bias in medicine. So, just to briefly talk about why we think this is, if you think historically, when we have the term hysteria, so women especially, were diagnosed with hysteria. Hysteria comes from the uterus, so that's where that term comes from. So it's associated with a woman's issue, and we thought of hysteria as women just having crazy symptoms and it's in their head. So there has been this historical bias against women and kind of believing their symptoms, that there's a physical or physiological cause for that. So I think it's just this historical bias that's one part that we're trying to get over. The bigger piece, I think, is that research is really, really lacking when it comes to women's health issues. So most of the research is done on white males, typically, which there's so much variation between obviously men and women, and then people of different ethnicities, that can make a big difference. So for example, we know Black women are more likely to get fibroids than white women. Women, like we just said, are more likely to die from heart disease than men. I mean, the list goes on and on. But again, a lot of the research money and funding is not going towards women's health. So I think there's that knowledge gap that if we put more money towards research, it would have a bigger impact. And then the last thing, which I already kind of touched on as far as why this bias exists, is definitely the racism piece. So there is, institutional racism, unfortunately, in our healthcare system. And there's been studies that show that people of color are, when they have things like pain, they're thought, for whatever reason, that their pain is less intense than people that are white. So it's just, for one example, this racism that's been kind of pervasive in the culture of medicine. So, sorry, this is really bummer news, but I wanted to end at least with a couple things we can do to kind of help change this. And one is just being informed. So knowing that this bias exists lets you go into a doctor's visits or into the hospital with eyes wide open, knowing that you need to be more, vigilant, unfortunately, and be more of an advocate for yourself when it comes to your health care. So that's my number one tip, is just kind of knowing that this bias exists, so that way you can kind of have eyes open for it. The second thing, which I hate that I even have to say this, is studies have found that as a woman, if you have some other male in the room with you during your healthcare visit, you are more likely to be believed and get better care. So whether that's your husband, partner, brother, friend, son, father, whatever, just having a male in the room, whether it's a female or male doctor, increases the quality of care that you receive and the more believability of your symptoms. So, if you can, if there's a serious thing you're concerned about, again, just bringing in, sadly, a male into the room makes a big difference. And then the last thing to kind of think about is, kind of standing up for yourself. Goes with the be informed, but if you know that something is seriously wrong, not just accepting that what that doctor or healthcare provider says is true, and either standing up and pushing for more testing and kind of being, like I said, an advocate for yourself, or get a second opinion. Doctors, it's the art of practicing medicine. Doesn't mean that they're right and what they say is 100% what's going on. Get a second opinion, get a third opinion, talk to different other healthcare providers. Don't just go with what that one person says. If you know that something is physically wrong, make sure that you see a doctor that's going to believe that and do a full workup. So hopefully that was helpful. Again, stay informed. That's why I do these videos and write articles and things like that, because I think it's important for women and men and everyone to know kind of what's going on when it comes to their health. Please let me know if you have any questions, or, I'd love to hear your thoughts or even hear your stories about how bias has shown up. Again, just keep adding it to my future book, maybe, sadly. And then for next week, I'm going to talk about, since March is also National Endometriosis Awareness Month. Seems like there's always a month going on, but I wanted to talk about 5 tips that you can use for endometriosis, which usually present with really painful and heavy periods, and it's a really common issue. About 1 in 10 women are affected. So, and last thing, as I notice here, this book is amazing. So if you are wanting to learn more about it, again, just staying informed, this book, Everything Below the Waist, by Jennifer Block, is great. You can see I'm still working through it because I'm just slowly digesting the information, but I'm highlighting, I'm taking notes. It's fantastic. So I highly recommend this book if you're wanting to learn more about everything that's going on.